If you're sick and tired of the symptoms of PCOS and also the lack of answers about the root cause of PCOS that you may have been getting from your healthcare provider, then this is the video you've probably been looking for. I'm going to go into detail about the root cause of PCOS, not just what causes the symptoms, and what you can do to start reversing that root cause today. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience. Let's talk about the ugly truth of PCOS. Women really get a crappy deal when it comes to the diagnosis and treatment of PCOS. First of all, it takes the average woman 7 to 11 years before she even receives a proper diagnosis of PCOS. And then doctors who very often have gross misconceptions about what PCOS is wind up treating a lot of the symptoms with different medications, but they very frequently completely neglect to talk about the root cause and what you can do to reverse that. PCOS, like many medical conditions, is completely misnamed. It was named back when we didn't know hardly anything about endocrinology or hormones and how they modulate all the physiological behaviors of your body. The cysts are actually not cysts, they're follicles, and the cysts on your ovaries actually have nothing to do with the diagnosis of PCOS. This is a leftover back when we just didn't know better. It's still called PCOS, but the cysts are not cysts, and they are not the cause of your PCOS. They're actually caused by the root cause that I'm going to explain to you in a minute. Probably 1 to 5% of the cause of PCOS is genetic. You inherited the predisposition for that. Probably 1 to 5% of the cause of PCOS is your mom's metabolic health and her diet while you were cooking in her uterus before you were even born. So that leaves us with 90 or 95% of the root cause that doctors don't seem to have a clue about. When you go see your healthcare provider about PCOS, all they want to talk about is drugs, drugs, and more drugs. You might wind up getting glucophage, you might wind up getting spironolactone, you might wind up getting finasteride, you might wind up getting clomiphene. You're probably going to wind up getting an oral contraceptive or a combined contraceptive therapy. None of these things treat the actual root cause of your PCOS. You deserve answers and you deserve a solution to your PCOS. You've suffered long enough, so let's get into this. When your doctor checks lab work like your DHEA level, your total testosterone level, your LH, your FSH, your cortisol level, your prolactin level, they're actually checking the distal or distant leaves on the tree. If we think about your PCOS diagnosis and cause as a tree, the trunk of the tree would actually be the root cause. The smaller branches and leaves are the causes of different symptoms, right? So all of the testing they're doing and all of the drugs they're giving you are treating the little twigs and leaves, the symptoms, not the root cause. They completely ignore the trunk. So what is the trunk? The trunk, or the root cause of your PCOS, is hyperinsulinemia. You have chronically elevated levels of insulin in your blood. When your insulin is chronically elevated, it causes all of your other hormones, including DHEA, total testosterone, your estrogen, your cortisol, it causes them to go in the wrong direction. And that's what leads to the symptoms of your PCOS. These symptoms can include irregular or absent periods, acne, hair where you don't want it or hair leaving where you do want it, skin discoloration, stress, depression, and more. The reason that your doctor's not even aware of your hyperinsulinemia is that they don't even know to check the appropriate lab work that would diagnose it. The two most common labs that can be used for this are a C-peptide and a fasting insulin. And I bet if you'll pull up all of your old lab work on your app or from that folder where you keep all your labs, you'll notice that these tests have never been checked on you. Thus, that's why your doctor doesn't know that you're hyperinsulinemic, is because he or she hasn't checked for hyperinsulinemia. When your insulin levels are chronically high, most of the tissues, like your muscle and your fat cells, they become what's called insulin resistant. But there are two tissues at least that remain insulin sensitive, and that's your ovaries and your adrenal glands. And that's where the hormones like DHEA, cortisol, estrogen, testosterone, progesterone, that's where they're all modulated. So you've got chronically high levels of insulin in your blood. And I'm going to tell you what causes that and what you can do to start to reverse it in just a minute. But your muscles and your fat cells become insulin resistant. So they're trying to cope with this hyperinsulinemia. Your ovaries and your adrenal glands are unable to become insulin resistant. So they remain insulin sensitive even in the face of this chronic hyperinsulinemia. So now the question is, what's causing you to have chronically elevated levels of insulin in your blood? It's your diet. There are certain foods, when you eat them, they spike your insulin very highly. There are other foods, when you eat them, they elevate your insulin a little bit, maybe many would say an appropriate amount, but then it doesn't go as high. There are other foods that barely elevate your insulin level at all. I've got this graphic up on the screen so you can see this. The thing that elevates your insulin level the most is carbohydrates. And the worst of all are highly refined junk foods made of sugar and grains. Those are what cause your insulin level to be chronically spiked very high and to stay high through the day. So now you know the root cause of your PCOS, hyperinsulinemia, and now you also know what causes your insulin level to be chronically high and to be very, very high. It is a carbohydrate overdose syndrome that's coming from the foods that you're currently eating. And these could even be foods that you've been specifically told by your doctor to eat, like whole grain breads, lots of fruit and fruit smoothies, a plant-based diet. All of these things can spike your insulin and keep it elevated all day long. So now let's talk about what you're going to do to reverse your hyperinsulinemia and therefore start to immediately reverse your symptoms of PCOS. The first step to reversing your PCOS via reversing your hyperinsulinemia is to drastically reduce the amount of carbohydrates you're eating in your diet on a daily basis. Now, the first carbohydrates that you definitely need to get rid of are the highly processed carbohydrates filled with sugar and ground up grains, okay? So all the junk food, that is directly leading to elevated insulin, which is then messing with your other hormones, which is then causing all of your PCOS symptoms. So when you reduce and get rid of the junk food, that's going to immediately start to help. And by junk food, I mean things that are full of sugar and ground up grains, okay? Now, for some people, reducing their total carbohydrate intake to less than 100 total grams a day, over the next few months, their PCOS symptoms will go completely away. Other people have to reduce their total carbohydrate intake daily to under 50 grams. And then a third category of people have to reduce them even further down to under 20 grams of carbohydrate a day. Now, it took years for you to develop the symptoms of your PCOS. So don't expect your PCOS symptoms to go away in a day or two. Your hyperinsulinemia will start to get better immediately, the same day you adopt a low carbohydrate diet. But it'll take weeks for your other hormones to get back in their proper ranges, and then it'll take weeks or months for the symptoms caused by those inappropriate elevation of those hormones to start to reverse and go back to normal. I call this therapeutic carbohydrate reduction, and that's what you should think of this as a therapeutic intervention. Many people call this type of diet a low-carb diet, a ketogenic diet, a ketovore diet, or a carnivore diet. I've got lots of videos on this channel about just that type of diet. And as I said earlier, this type of diet is going to start to reverse your chronically elevated insulin level immediately, within hours. Your insulin level will start to return to normal. Your body is not broken, and you are not stuck with PCOS for the rest of your life. You can take charge of this today and start to improve and even reverse your PCOS symptoms as soon as you're finished with this video. Talk with your doctor before you decide to stop any of the current PCOS medications that you're taking, But what you're going to notice as weeks go by after you've adopted a therapeutic carbohydrate reduction regimen in your diet and in your life is you're not going to need those medications after some point in this therapy. And when that time comes, you and your doctor can decide together to stop your medications. If you have a friend suffering from PCOS, it might help you and her to actually do this therapeutic carbohydrate reduction together. And also, it'll help me to reach more people and help her if you share this video with her. This is Dr. Berry. I'll see you next time.